Hi, I'm Miles McNamara, Certified Senior Advisor and owner of Comfort Keepers in Home Care. Our caregivers help you in your own home. A Comfort Keeper can provide companionship, meal preparation, medication monitoring, assistance with personal care, transportation to doctor appointments, all enhancing your independence and safety in the comfort and privacy of your own home. So if you or someone you love could use a helping hand at home, call Comfort Keepers at 287-4200. That's 287-4200.
Hey there, it's Tori with your hometown station weather. Mostly sunny this week with highs in the low to mid 90s. Overnight lows in the mid to upper 60s. Summer is still kind of hanging around. For everything SCV related, go to hometownstation.com or check us out on social media. Facebook, Twitter, and Instagram at KHTS Radio.
Your hometown station, KHTS.
Good morning, Santa Clarita and surrounding areas. Welcome to Aging with Power, sponsored by Comfort Keepers in Home Care. I am your host, Miles McNamara, and our show focuses on the challenges and the topics we face on this journey that we call aging. We begin aging when we take our first breath, right? And although our show will focus and primarily deal with adult and senior issues, we will from time to time visit areas of the entire aging spectrum, from the womb to the tomb. Our subject matter experts will address concerns and questions to empower us to make informed decisions. If you ever have a question during the show, give us a call at 661-298-5487. We would love to address your issues, pass along your questions, and we will do our best to address your concerns. Again, that's 661-298-5487, because after all, preparation is knowledge, and knowledge is power. And we are also live on Facebook. So just search for KHTS Radio if you want to tune in and see what we're all sitting here doing and twiddling our thumbs while we'll talk. But again, it's Facebook. Search KHTS Radio and join us on Facebook Live. And you can, I don't know, Kyle, are we monitoring questions on Facebook as well?
Yes, we are.
We are. And that's Kyle, our sound engineer. Hi, Kyle.
Hi.
Today, we have a great show for you, folks. Lots of information coming your way. In studio, I have Dr. David Wong, internal medicine physician for 24 years with Kaiser Permanente. Good morning, Dr. Wong.
Good morning.
So appreciative of you taking time out of your busy schedule. So you may not know, folks, or you may, or you will after today. Kaiser is expanding their footprint in a big way here in Santa Clarita, and we no longer have to leave the valley to get the medical care that we need. So Dr. Wong's going to be addressing that and some other topics along the way. Also in-house with us, and she thinks she may not talk, I might let her get away with it, is Chelsea Shriver, her public affairs representative for Kaiser, who set this whole thing up. So thank you, Chelsea.
Thanks, Miles. Happy to be here.
And then the second half of the show, again, information packed as I promised, we have Paul Davis with Paul Davis Insurance calling in. Paul does full services of health insurance and such. We are going to focus on the upcoming open enrollment that Paul is an expert in, actually, and that's the Medicare Supplement Insurance, sometimes referred to as Medigap. Also the Medicare Advantage plans, which when you assign your Medicare benefits to an HMO or PPO, and then the ever-changing Medicare Part D, the RX, the drug plans, where every year they may be changing their formularies, and the medication that you were getting covered last year may not be covered next year. So it's important that you do your due diligence during open enrollment, because you can change your provider at that point in time. And Paul is going to give us an overview of that and many other things. I've known Paul a long time. He helped me with my own mother's insurance needs, and he's best insurance agent by readers of the Daily News for 17 straight years. He's a trusted advisor by the San Fernando Valley Business Journal. I mean, Paul's the real deal. So, again, that'll be the second half of the show. Open enrollment happens once a year. You can change your health plan if you're not happy with it. So stay tuned for that. If you miss any of today's podcast or you hear something that you want to pass on to your friends, you can always go to KHTS website at hometownstation.com. Click on podcast. Look for Aging with Power, and you can listen to any show that we've done here throughout the decades now on Aging with Power with a all-encompassing set of topics. Again, mostly dedicated to our seniors and aging population, but we'll dip wherever on the timeline we feel is necessary. And also, before we take our first break, I want to make an announcement coming up. Our annual Caregiver Resource Days put on by our Santa Clarita Valley Senior Center. It's Knowledge is Power, Aging with Dignity Symposium. But the family caregiver out there, it's Saturday, September 15th at 9 a.m. at Kaiser Educational Center. So, again, call me or check in with KHTS for the Saturday, September 15th from 9 a.m. to 3:30 at Henry Mayo. And we are going to take our first break. Again, folks, coming up after the break, we have Dr. Wong from Kaiser Permanente to talk about the ever-growing footprint and services provided by Kaiser right here in the Santa Clarita Valley. You're listening to Aging with Power. I'm Miles McNamara on your hometown station, AM 1220 and 98.1 FM.
The best live theater can be found right here in the Santa Clarita Valley. The Canyon Theater Guild has been entertaining audiences for decades with top-quality musicals and plays. Located on Main Street in Old Town Newhall, CTG also offers workshops for the young actor in your family. For more information, call the box office at 799-2702 or go online to canyontheater.org.
There is only one language spoken at Thai Dish, and it sounds something like this.
This is great.
Once people get a taste of Thai dishes, there's really no reason to do any more talking. Make it full of flavor, make it delicious, only at Thai Dishes. Enjoy the atmosphere, love the food. Thai Dishes on Valencia Boulevard for free delivery, 253 Food. That's 253 FOOD.
It's never been so easy to have a great night out. Whether it's a date night or girls' night out, experience Pinot's Palette in Valencia or Encino. Order your favorite drink from the bar and paint your very own masterpiece. No art experience needed. Local artists make it easy for you. So you can paint, sip, and listen to great music while creating a one-of-a-kind masterpiece. Fun, relaxing, and memorable. Pinot's Palette. To book your party, go to pinotspalette.com. That's pinotspalette.com.
Vargo Physical Therapy is a leading provider of rehabilitation treatment for sports and industrial injuries, as well as post-operative and age-related conditions. Vargo Physical Therapy patients have access to the best high-tech and most effective rehabilitation equipment. With locations in Canyon Country and Valencia, Vargo Physical Therapy has been serving the Santa Clarita Valley for over 15 years. Go to vargopt.com. Vargo Physical Therapy helps you get back in the game.
KHTS, your hometown station.
Welcome back, folks. You are listening to Aging with Power on your hometown station, AM 1220 and 98.1 FM. If you're just joining us in studio today, we have Dr. David Wong, internal medicine physician with Kaiser Permanente. In the second half of the show, we will have Paul Davis of Paul Davis Insurance talking about the upcoming open enrollment and the time of year that we can all change our health care plans if we are not happy. So, but again, in studio, Dr. Wong, I know you're a busy dude. I appreciate you taking the time to come out and talk to us. Welcome to Aging with Power.
My pleasure. Thanks for inviting us.
My pleasure indeed. So again, kind of walk us through Dr. Wong's journey and what brings you to Santa Clarita.
Well, I was raised mainly in California. I was born in Hong Kong, but I came here around 2. And I went to medical school in Medical College of Wisconsin, which is Marquette University in Milwaukee. They changed the name for financial reasons. And they got a huge fund from a Lutheran, so they're Catholic, so they had to change the name a little bit. Then I went to UCLA for my residency, and when I came out of UCLA, I did 1 year teaching. I knew I wanted to join Kaiser because Kaiser. A lot of people said you should go in private practice. You should do that. But I really felt that I wanted to take care of patients. That's really what I wanted to do. I didn't want to deal with the business component. And Kaiser allows physicians to make their own decisions. There's always a physician that makes involved in any decisions associated with Kaiser. In any meeting you go to, there's a physician that makes the decision, which I thought was really important because we're taking care of the patients.
Right.
And so I started actually in Santa Clarita. That was my when I started with Kaiser, actually in a strip mall right across Home Depot. I was there for about 6 months. There was only 7 physicians. And then we went to a building in 1994 to the one on Turney Road, which is the MOB-1. In there...
And MOB means?
Medical
office building.
Office building,
okay.
yes.
I just want to know I had the right acronym.
And now we have about 50 primary care physicians there. So from a little strip mall of 7 doctors now to 50. It's got a lot bigger. And originally the building was supposed to open early that year in 1994. But you guys remember what happened January 1994?
I
There was
do.
a huge earthquake. And because of that, there was a delay of 6 months. They wanted to reinforce the whole building before we opened. I think we opened about October of that year. And excitingly, this year, we have this new building, the Medical Office Building 2, which is having subspecialty and day surgery. So there's always been a clamor of patients that say, hey, it's a little long drive, even though it's only, I don't know, maybe actually 15 minutes, there's no traffic.
Right.
But with all the traffic we have to get to Panorama City or to the Valley, patients were asking, can we get care up here? And that's what we wanted to do. We wanted to bring care to our members.
So with the 2 office buildings now, all the oncologists, so to speak, and the oscopies, everything's done here, or is there still some procedures that we have to go over the hill to Panorama City or the Valley for?
I would say majority will be done here. Now, if you're a very complicated case, they would probably prefer you near a hospital, so
Right.
you'd probably do it in Panorama City. But I would say 90% of the stuff could be done here.
That's awesome. And I mean, Panorama City's fine, but who wants to drive over there? Because you always have to get a driver, and you got to get them to bring you back, and all this sort of stuff. So, are you basically involved in MLB1, MLB2? I mean, how do you work your daily functions with Kaiser, and what should folks know about the 2 different office buildings?
So I am primary care, so I'm mainly in MOB1, and I've been there, like I said, for 24 years with Kaiser, so I kind of like and be familiar with that.
Right.
So if you want to do mainly, if you are seeing somebody in primary care, that would be MOB1. The nice part of Kaiser facility, everything is there. You have your x-rays, your labs, everything is done in one place. It's the same thing with MOB2. You will have all that, so you don't have to go to a different place, come back, and go to get labs to another place. So everything's contained in that one building. So that's kind of nice for us, too. So we can ask the patient to go get an x-ray, come back, in 5 minutes, we take a look at it. Same thing with labs. So.
Now, I know I mentioned that we have the second half of the show, we have Paul Davis talking about the open enrollment coming up and the Medicare folks. I know a lot of seniors are taking their Medicare and they're assigning it to Kaiser. So how do you guys focused on the senior community and the seniors that we have here in Santa Clarita if they want to choose Kaiser as their Medicare Advantage plan?
You know, we have a great senior advantage plan. I don't know if you guys know, we have a 5-star rating, which is the highest you can get in California. And we've had that for, I don't know, Chelsea would know, 7 years, I think.
Okay.
And they look at all these different metrics taking care of our patients. And we hit every metrics associated with that. So I would tell patients that if they came to Kaiser, they're doing the right thing. We have the one nice part with since 2007 is we have this computer system that tracks everything that the patient needs. So if you came in and Miles, you needed a colonoscopy, it'll pop up. The nurse says, "Hey, Miles, you need a colonoscopy," and you see me, I'm going to I'll tell you the same thing. So you get every care that you need before you leave the building. And we try to make sure you have an appointment to make sure you leave with an appointment.
Well, and I can attest, as I told you prior to the show, that I became a Kaiser member, in January, and it truly is. I mean, you guys are, I believe, ahead of the curve in a lot of different areas. I mean, you have an app for our smartphone that you can do most of it right there. You can email your doctor. They send you appointment notifications. You can fill your pharmacy prescriptions right there on the app. I mean, it's amazing stuff. And I know some of our seniors don't. I mean, actually, the seniors are the largest growing demographics for computers and smartphones now anyway. So, I mean, they're loving it just as well. So again, open enrollment, folks, I would consider Kaiser Permanente as your Medicare Advantage plan. We're going to take our next break here in a minute, and when we come back, we're going to continue talking with Dr. Wong about Kaiser's ever-growing footprint and presence here in the Santa Clarita Valley, folks. It truly is magnificent. If you're considering it, get over there on Turney Road and take a look at their 2 office buildings. I mean, state-of-the-art everything. So I can't endorse Kaiser enough. But anyway, we're going to take our break, come back, continue chatting with Dr. Wong. You are listening to Aging with Power. I am still your host, Miles McNamara, on your hometown station, AM 1220 and 98.1 FM. Hi, I'm Miles McNamara, Certified Senior Advisor and owner of Comfort Keepers and Home Care. Our caregivers help you in your own home. A Comfort Keeper can provide companionship, meal preparation, medication monitoring, assistance with personal care, transportation to doctor appointments, all enhancing your independence and safety in the comfort and privacy of your own home. So if you or someone you love could use a helping hand at home, call Comfort Keepers at 287-4200. That's 287-4200.
Your building sign is essential in getting customers to your location. Feathers can help get your business noticed. They walk you through each phase of your building sign project, providing special attention to detail and quality. Feathers will give you a sign you can be proud of. Your building sign will draw customers in instead of having them drive by. Feathers on Soledad in Canyon Country, across from the Edwards Theater. Or go to feathersphoto.com. That's feathersphoto.com.
I've always been driven to serve our country and our community.
Congressman Steve Knight.
I served in the United States Army and spent 18 years as an officer with the Los Angeles Police Department. I ran for Congress because too often I saw people forgotten by Washington. The crisis at the VA exemplified a bureaucracy that was out of touch and hurting real people. As your congressman, I'm committed to making our government in Washington work better for you.
My name is David Brayton. I am an Air Force veteran. 10 years ago, my doctors told me that I had to have a double lung transplant. It was a massive uphill battle to get the VA to do what they said they were going to do in the first place. Finally, Steve Knight got involved, and if it wasn't for Steve Knight's assistance in this thing, I guarantee you I'd be dead. Steve Knight is a veteran, and he's LAPD on top of it. I'm voting for Steve Knight because he gets stuff done for us.
I'm Steve Knight, and I approve this message.
KHTS, your hometown station.
Welcome back, folks. This is Aging with Power on your hometown station, AM 1220 and 98.1 FM. We are talking with Dr. Wong of Kaiser Permanente, and coming up in about 1.5 segments, we're going to be hearing from Paul Davis of Paul Davis Insurance, talking about the open enrollment and Medicare and Medigap and Part D coverage that you should be thinking about. But anyway, again, Dr. Wong, so pleased to have you here at Aging with Power. We've talked about Kaiser, we've talked about the footprint, we've talked about MOB 1 and 2 and all the oscopies and ologists. Now let's talk about actual care. You were talking about the importance of primary care, preventative care, immunizations, etc.
Yes, part of the reason why I joined Kaiser, and I felt that was the new trend, is you need prevention. Prevention is really the key. I was actually at a seminar with a bunch of the local physicians here at COC, and we were talking about cancer. And all of us agree, how do we cure cancer? It's to prevent it. Before it gets worse, you want to stop it.
Right.
You want to take care of yourself, you want to eat healthy, you want to do things that could decrease the chance of getting cancer. The same thing with your health. It's the same concept. It goes to the same basic. There's no magic pill, unfortunately. I'm sorry to tell everyone. Is you have to exercise, you have to eat healthy, and get your vaccinations. We know for a fact that as it's coming up, the flu's coming up, thousands of people die from the flu. Yes, it's usually the younger and the older, but there are thousands of people. If people get the flu, there's something called herd immunization. If everybody around you has the flu shot and they don't get the flu, the chances of an infant or older person doesn't get it because they're not around those type of. The real concept is everyone should get the flu shot.
Well, let me ask you a question straight up, because we've heard eat right and exercise since the day we could breathe. I mean, that's a given, and we get tired of hearing it, but it's amazing how many people don't do that. But immunizations, I mean, I'm just going to ask you a lot of what I hear from my seniors and such. It's a different strand. I don't want you putting that virus in my body. It doesn't really work. What do you say to folks who say, you know, how can we be sure that it'll be the right strand of immunization for the flu? I've heard there's 100 different strands. And why do I want that virus put into my body to begin with? What would you say to folks that are always pushing back like that?
I would tell the government looks at these immunizations and they vet it through. What they look at is what is happening during the winter time, because during our summer is the winter time in South America and Australia. They look at the strand and they convert it around or change it to what they believe is what we're going to get. There are a bunch of different strains. Yes, you're correct. And those are from O strains from in the past, like the H3N2. So they'll have these type of strands. If you get the immunization, if you get it regularly, then you, even though, let's say they missed a little bit component this year, you have immunity to the other strands. Because the problem with the flu is it mutates, and it can mutate, and that's where we get the issues.
And what do you have to say to folks who are always talking about, again, as I said earlier, why do I want to put that dormant virus in my body to begin with? And all this stuff, propaganda, whatever it is you hear about, you know, causing autism in kids and all these vaccines, not necessarily the flu vaccine, but other vaccines. I mean, people are scared to death of vaccines. How do we calm that fear?
You know, I can only say that there's never been a study that I know of that shows that there is a correlation with autism and the vaccinations. Yes, some people can get a side effect like a little bit of fever, irritation in the arm. There is something called Guillain-Barré that you can get, which can cause nerve damage. But in reality, it's very, very low. Everything in life is risk and benefit. And if you look at the benefit of giving the flu shot or taking the flu shot, outweighs the risk. You know, you're driving a car is a risk and benefit. So I would say to calm people, a lot of people will ask me, well, I got the flu because I get the flu shot. Well, it's a dead virus. You're just getting antibodies. Your body's producing the antibodies. That's why you're getting those type of symptoms.
Right. And also, we've talked a lot about it on the show in the past, but I love to get a physician's point of view. And folks just don't understand. It's not about your dad and your mom. It's not about it's even if you have children who turn 18 or are now legal adults, you can't play the mom card or the dad card. How important is it, not only generically for folks, but from your point of view as a physician, when people don't have their roadmap, i.e., an advanced healthcare directive. Some folks call it the 5 wishes. Some call it PULSE, physician's orders for life-sustaining treatment. What would your advice be to people who may have never heard of this, or to either revisit it or revamp it? But from a doctor's point of view, how important is that?
I think it's very important. You really want to do what is right for yourself. You can always change your mind. I mean, you're like 18 and say, well, I don't have to think about that. Well, you can just start it off, and you can change it any time. It's your prerogative. But it's very important for us, even if you're 18, you get in a car accident, as a physician, I want to know what to do for you, is what your wish is. We don't want to harm anybody. We don't want to do anything wrong. We took an oath of that. Whatever the patient wants is what we will do. If he wants everything done, we'll do everything possible. If they want nothing done, we won't, but we'll make them comfortable.
And what's important, what you just said, is what do they want? How many times have you seen adult kids standing in the waiting room arguing about what mom would have wanted or what dad would have said? I mean, you must see that every day.
Yes, and we see that, and it's very unfortunate where you have a patient that is on a vent, on a bunch of machines, vegetable, but we can't do anything because their argument, and it may have to end with court. And this patient is suffering could be months before the court finally makes a ruling.
Well, and that's such a good point, because they can stand in the waiting room and argue all they want, but you've got to listen to the court. You can't even listen to them because they don't have the legal right to speak on their behalf.
Correct.
That must drive you. That must frustrate you to an unbelievable level.
It's great. Yes, when we get in those situations where nobody's happy, it's not fun. Yeah, I think the couple thing is, one, for life care, you have to select someone you trust to make sure your health decision and make specific instructions what you want. Those are, I think, the two major questions that you need to think about.
And you mentioned it, and you hit it right on the head, is folks say, I'm only 18, I'm only 20, I don't need that yet. We can't see the future. I mean, you could be in a car accident, you could get hit by a bus, you could get ran over by a tractor, who knows what could happen. But yeah, so don't think that you're immortal. Don't think that, it's not going to happen to me, but especially for your aging loved ones, for your parents, for your grandparents. If they don't have an advanced healthcare directive, gosh, we can't stress that enough. But anyway, Dr. Wong, I can't thank you enough. I hope you're going to stick around and listen with Paul and maybe even chime in if you have a question for him as well. If they want to get a hold of Dr. Wong, I mean, Chelsea told us during the break that you can just, contact me, drop me an email at miles@comfortkeepers.com or KHTS. Give us a call over here at 298-12. What is that, Kyle? 298-1220. There we go. And then we could also set you up and get you in contact with Dr. Wong or anybody over at Kaiser. So we're going to take our next break. Hopefully we'll be able to talk at the end of the show if you're going to hang around. But if not, I appreciate you coming on. Kaiser's an ever-growing presence here in the Valley, and you guys are awesome.
Well, thank you for inviting us.
My pleasure. Okay, folks, we'll be right back. You're listening to Aging with Power on your hometown station. And coming back, we'll be talking with Paul Davis of Paul Davis Insurance regarding open enrollment. Don't go away.
Santa Clarita Philharmonic has begun its season of free concerts. The SCP is a non-profit community-based volunteer symphony orchestra comprised of local musicians from throughout the Santa Clarita Valley who are dedicated to providing quality classical music for the residents of the Santa Clarita Valley. Like the Santa Clarita Philharmonic on Facebook or visit santaclaritaphilharmonic.org for more information.
Your hometown station.
KHTS is your official Santa Clarita Dodger station. You can catch all evening games right here on your hometown station. For all the latest news and updates on your Los Angeles Dodgers, KHTS has you covered. Go to hometownstation.com.
98.1 FM and AM 1220.
Save water and save money. SCV Water wants to help you find your fit and take advantage of conservation rebate programs that will help you save. Find the programs that fit your needs and start saving today. To learn more, visit conserve.yourscvwater.com. That's conserve.yourscvwater.com.
KHTS, your hometown station.
Join City of Hope today in the fight against cancer. Make a difference by participating in City of Hope's Together for Hope, presented by Antelope Valley Hospital and High Desert Medical Group on Saturday, September 15th. Be a part of this inaugural event in partnership with City of Hope Antelope Valley and show your support toward groundbreaking research to treat and cure cancer. They welcome everyone to their 2K walk, 5K run in honor of the individuals in our lives affected by cancer. City of Hope, the miracle of science with soul. Join the movement today by registering at togetherforhope.org.
Hometown, your hometown station.
Welcome back to Aging with Power, folks. I'm Miles McNamara of Comfort Keepers in Home Care on your hometown station, AM 1220 and 98.1 FM. As I said at the top of the show, we have calling in for us right now Paul Davis of Paul Davis Insurance, the man, the myth, the legend. As I also mentioned, personal experience with Paul. He helped me with my own mother's journey through these open enrollment periods, and when it was time to choose a Medicare Advantage plan or to stay where she was at Medicare full coverage, blah, blah, blah. But Paul has amazing credentials, folks. He's been designated the best insurance agent by the readers of the Daily News for 17 straight years. He is definitely an expert in his field. He's my expert. I lean on him a lot for anything that comes up. So I'm going to stop babbling now and say, Paul Davis, welcome to Aging with Power.
Thank you for having me on the show. I appreciate it. I think this is my third time back.
Absolutely, and that's only because you've got such vital information, Paul, because I think folks are so confused what their, I was going to say rights, that might be overstating it, but what their ability is when it comes to this once a year, what we call open enrollment. Why don't you give us kind of a little bit of breakdown, first of all, what does that mean, open enrollment?
Okay, so first of all, it's called two different things, annual enrollment period, but technically it's the annual election period, AEP in any sense. And between October 15th and December 7th of every year, anyone who's on a Part D prescription drug plan or a Medicare Advantage plan has the ability to change to a different plan. Also, anyone that missed the opportunity to get on at some prior time, that's an open enrollment for anyone who's on Medicare Parts A and B to get on a Part D plan and to get on a Medicare Advantage plan.
And when someone calls you for advice, it may also be going off an Advantage plan and getting back onto straight Medicare with a Medigap coverage, correct?
That's correct. So that's not as easy a path because there's no guaranteed path to get off of a Medicare Advantage plan and enroll in a Medicare supplement plan. There are some special circumstances, but that would take 3 of your shows to go into, so we won't go into that. But if someone says, I'm on a Medicare Advantage plan, I'm not happy with it, I want to go back to basic Medicare and get a Medicare supplement plan, then my next question is, can you answer some health history questions, because that's what will be required.
Right, and that was kind of the journey we took with my mother. She was on a silly plan up there in the sticks, and she was not getting the right, so you brought her back to the actual straight-up Medicare. But with that said, so let's go the other way. We've got grandma out there. She's on Medicare. She's not aware of what a Medicare Advantage plan is. She's not aware of what our options are. So what would you advise a client when they come to you and say, you know what, Paul, I don't know if mom's getting the right coverage?
Yeah, and I'm getting more and more phone calls exactly like that, or they think that mom or dad has been neglectful at getting any coverage. I've had some that all mom enrolled in was Medicare Parts A and B. She doesn't have a drug coverage, she doesn't have a supplement, she doesn't have an Advantage. What do we do? So my first step in any new person I come in contact with is, okay, get me your list of medications, because we want to see what's the best plan for you that will cover all your drugs effectively. Get me the list of the doctors that you want to have access to, and we need to try to see what plans would allow you to access those doctors. And then the third thing is, tell me what your budget is. What can you realistically afford going forward for the type of plan? And when I get those 3 filters, the drugs, the doctor, and the budget, it makes the process fairly simple because it starts limiting and restricting, and we converge on a plan that's going to be suitable for them going forward.
And in your experience, Paul, what do you see the main reason for folks going away from straight Medicare and into a Medicare Advantage plan?
Well, straight Medicare that has the disadvantage of no cap on the out-of-pocket expense. So if you're hospitalized and all you have is Medicare Part A and B, you're going to have about a $1,350 deductible. If you're still in the hospital after 60 days, it goes up to over $300 a day, and after 90 days, over $600 a day. And straight Medi-Cal has a max of $150 days in a hospital. Now that's fine for most people, but I had someone last year or the year before that was in UCLA for 7 months. And if they didn't have something to augment basic Medicare, they'd have been mortgaging their house to pay for the cost of hospitalization. Outside of the hospital, you've got a $183 deductible, which isn't bad, but then a 20% coinsurance. So if you need chemotherapy and radiation therapy and lots of other treatments that add up in the tens of thousands of dollars, you're going to have a 20% share of cost for that with no cap. That's the part that scares me about someone who only has basic Medicare Parts A and B.
And how often do you see folks who aren't even aware of that little jewel we call Medigap?
Everyone I encounter has some level of confusion about Medicare. If I meet with someone for 2 hours and go through all the basics and information, and I called them a week later and quizzed them on what we talked about, they would only retain about 2% of it. So people don't recall, and people transpose the Medigap and Medicare Advantage. They get them confused. So quite honestly, what I tell people is the best thing to do is find someone that you trust and that knows what they're doing in this area, and rely on their knowledge. Because I've had people that say, we've spent 40 hours researching this, and what did you come up with? And they show me, and I said, I could have told you that in 20 minutes.
Which is huge, and we'll get to that in a minute. But could you, in the 90 seconds we have left till our first break here, what is Medigap? If someone's listening out there and they're thinking, I had no idea that I could get any kind of a supplemental insurance to help my exposure with straight up Medicare, what would you tell them?
Okay, first of all, Medigap and Medicare supplement are two terms to describe exactly the same thing, which adds to the confusion. With a Medigap plan, you can go to any Medicare contracted provider anywhere in the country. That's an enormous network. With the top-of-the-line Medigap plan, which is Plan F as in Frank, that's the most popular plan. That's also the most expensive plan. You have no deductible and no share of cost for any services as long as they're covered under Medicare and you're seeing a Medicare contracted provider. So people love that they've got this enormous network and they have predictable pricing and costs going forward because they know they're not going to be paying for anything.
Wow. Well, we're going to continue that, Paul. We're going to take our next break, and when we come back, I know folks are as confused about Part D as in dog because, gosh, my medication was covered last year, but now it's telling me no this year. We'll get into that.
Yep.
So don't go away, folks. You're talking with Paul Davis of Paul Davis Insurance on Aging with Power on your hometown station AM 1220 and 98.1 FM.
Local rental store. No matter how big or how small your home project is, AB Equipment Rental has the tool you need to do the job right. From painting to plumbing, landscaping to automotive, their knowledgeable staff will make sure you get the right tool for the right price. In fact, they'll even help you load it into your car. I bet you didn't know they have propane to fill your barbecue tank, and there's no minimum quantity. With a large supply of tools and helpful and professional staff with a hometown service attitude, AV Equipment Rental is your local Santa Clarita rental authority. Stop by AV Equipment Rental today on Railroad Avenue in Newhall.
What's the perfect way to end the weekend? Sunday brunch at Salt Creek Grill, of course. Wind down with delectable dishes off Salt Creek's award-winning menu and enjoy a glass of champagne because, after all, you deserve it. Make Sunday brunch at Salt Creek Grill a new tradition with your family and friends. Salt Creek Grill in Valencia on Town Center Drive in front of the movie theater. For reservations, 222-9999 or go online to saltcreekgrill.com.
Hi, I'm Miles McNamara, Certified Senior Advisor and owner of Comfort Keepers in Home Care. Our caregivers help you in your own home. A Comfort Keeper can provide companionship, meal preparation, medication monitoring, assistance with personal care, transportation to doctor appointments, all enhancing your independence and safety in the comfort and privacy of your own home. So if you or someone you love could use a helping hand at home, call Comfort Keepers at 287-4200. That's 287-4200.
Hey there, it's Tori with your hometown station weather. Mostly sunny this week with highs in the low to mid 90s. Overnight lows in the mid to upper 60s. Summer is still kind of hanging around. For everything SCV related, go to hometownstation.com or check us out on social media. Facebook, Twitter, and Instagram at KHTS Radio.
Hometown, your hometown station.
Welcome back, folks. You're listening to Aging with Power on your hometown station, AM 1220 and 98.1 FM. Don't forget, we mentioned it at the top of the show, we are live on Facebook. So tune in. Just search for KHTS Radio, and you can shoot us any questions or comments or whatever. And Kyle, our sound engineer extraordinaire, will forward them on to me. But anyway, on the phone, we have Paul Davis of Paul Davis Insurance. And as I mentioned when we brought him on, over 34 years of experience, best of for like 17 straight years with the Daily News. I mean, he is an expert, in my opinion. We lean on him very heavily, both myself and my wife, who has an elder law practice as well. So again, Paul, I appreciate you taking time out of this very busy part of your year as we talk about open enrollment. And prior to the break, we were talking about the different Medicare Advantage plans and what that means to assign your Medicare benefits to a Medicare Advantage plan. Crystallize that for us. How do people do that, and what don't they know that they don't know?
Okay, so Medicare Advantage plans have been around for several decades now. And the way it works is if someone is on Medicare Parts A and B, they can enroll in one of these plans at an initial enrollment period or during the annual enrollment period, and they are then assigning their Medicare benefits to an insurance company that then becomes their provider of Medicare services. And these Medicare Advantage plans are mandated to have benefits at least as good as Medicare. And in many cases, the benefits are superior to what you get with basic Medicare. Many of them have a zero copay to see a doctor, zero copay for hospitalization. The way people choose these plans comes down to, again, what doctor is it or what medical group is it that they want to have access to, because that doctor and all the specialists that they want to see all have to be contracted under the same medical group to the same plan. And then the second issue is what prescription drugs they're taking and what's covered most cost effectively. Now, anytime we're helping someone with this, we shop their drugs on Medicare.gov, and we see clearly sometimes one plan or a couple plans have a superior cost to the person over other plans, and that will inflect our recommendation. And then the third thing we look at is what are the basic benefits of the plan, the co-pays, the cost exposures, what their maximum out-of-pocket is in a calendar year, I think is very key, because it can range currently from $1,500 to $6,700. So we factor all that in helping people decide which plan might be most suited to them.
Yikes. And as you know, we have Kaiser in the house here today. I mean, what are Advantage plans that folks may not even be aware of out there besides Kaiser, and I believe Facey is one? What are the types of Medicare Advantage plans that folks have out there to consider?
Well, Facey is not a plan. Facey is a medical group, and I'm not sure, but because this is a purely educational presentation, I'm technically not allowed to mention the names of carriers.
Okay, moving on. So we were talking about Part D as in dog. So important. Why don't you talk to us a little bit more about the mistakes you see people make there and why they go sideways on their formularies, and then as we kind of bring it home, how could people tap into your expertise as well?
Okay, so if someone has just basic Medicare and they need to have some prescription drug coverage, or more often someone has a Medicare supplement plan, they need to get a Part D coverage because Medicare supplement plans don't cover that. We reshop all of our clients' Part D prescription drug every single year because things change. The list of drugs changes, the tiers change, the restrictions change, and what we found when Part D first came out is we'd have people going to the pharmacy in January and February, and they'd be calling us, and they'd be very upset because they were just finding out then that there was a change to the drugs that they were taking. So we encourage all of our clients to reshop the Part D between October 15th and December 7th. I shouldn't restrict that. Not just our clients. We encourage everyone to shop their Part D. You should be getting an annual notice of change on your Part D and your Medicare Advantage plans in the next 2 weeks. That will lay out any changes to the benefits, and then you should either call the plan or call your agent or seek out resources on Medicare.gov to make sure your drugs aren't going to be covered in a different way in January. So if a drug is dropped off the formulary, you could go in to refill it and say, sorry, that's not covered anymore, and you'd have to go through an appeal process to get it covered. During the annual enrollment, if you identify that, you could perhaps change to a different Part D plan that would offer superior coverage. And the formularies for each of these Part D plans are different. I don't know that there's any two that are identical. They all publish them, but there's no simple way to compare side by side which plans have the best formulary. When we shop thousands of people during the course of the year, we start getting a sense of which plans might be the default plans in the absence of any other clear evidence.
And I think it's important to mention that Part D has absolutely nothing to do with your Part A and B and where you assign that, correct?
Correct. Part A and B you get from the federal government. Part D is purchased from an insurance company. Now, if you purchase a Medicare Advantage plan, most of those sold in Los Angeles cover Part A, Part B, and they include a Part D prescription drug coverage.
And I know we talked about it off air, Paul. They're always doing this kind of stuff to us. What's changing and what's new for 2019?
So it's already changed, but some people are still getting their new Medicare cards. And it's important to know that you eventually should be getting a new Medicare card that's a random number generated. Your old Medicare number, which is your Social Security number with a letter after it, is still going to be good through December 2019. But between now and then, you should start you should receive and should start using the new Medicare card. Also, there's a new Medicare Advantage open enrollment period from January 1st to March 31st. This may give people a one-time opportunity to change a Medicare Advantage plan. They shouldn't consider that an additional part of the annual election period. It's not the same. There aren't as many choices. You can't change your mind. So I know some people are going to think about, well, I'll just wait till next year. I'll do it next year when it's not as busy. That's not a good idea. You should still look at things between October 15th and December 7th because you have many more choices at that time.
Well, you said something, I want to clarify this, because also, isn't there a buyer's remorse period? Like if they make a change in the open enrollment period, they have X amount of days to say, oops, I made a mistake?
So in the annual election period, October 15th to December 7th, you could apply multiple times. Someone could theoretically go to 6 different presentations and each time decide, oh, that's the best plan. And whichever is the last one they've signed up for on December 7th, that's the one they'll have for January 1st.
Gotcha. Well, we're going to put a bow on that after our next break, Paul. When we come back, we'll put said bow on it, but then we're going to address how do folks find Paul Davis, how much does your service cost to them, and how do they tap into your expertise? So if I may impose to hang with us for about another 5 minutes, Paul, we'll address all that after the next break.
Absolutely.
Awesome. You are listening to Aging with Power. I'm Miles McNamara on your hometown station, AM 1220 and 98.1 FM.
Have you got a young one who's always on the go? Ice Station Valencia has an incredible program. Our Little Tykes hockey program for ages 3 to 6 makes it easy and affordable to introduce your child to the awesome sport of ice hockey. We provide most of the hockey gear for free to get started, including shoulder pads, elbow pads, gloves, and jersey. You'll be amazed at how quickly your child takes to the ice. Call 775-8686 or skate to the net, www.icestation.net.
Mission Valley Bank is a commercial bank in the Santa Clarita Valley that really puts the community into community banking.
At Mission Valley Bank, we strive to be a trusted advisor to our clients, and that means being an integral part of the communities we serve. We started the Give Where You Live program to help bring awareness to our nonprofit partners. We're more than just a local business bank. In fact, we're a full-service, independent commercial bank that is locally owned, community-minded, and relationship-driven. I'm Tamara Gurney, President and CEO of Mission Valley Bank, and I invite you to experience the Mission Valley Bank difference, where your success is our mission. We want to be your most valued bank.
Mission Valley Bank has been named Most Trusted Advisor Business Banker by the San Fernando Valley Business Journal 5 years in a row and received the Business Leadership Award by the Santa Clarita Valley Chamber of Commerce, Valley Industry Association, and SCV Economic Development Corporation. Visit them at their Center Point branch location or at missionvalleybank.com. Member FDIC.
The SCV Pregnancy Center has provided compassionate, personalized, and confidential care for 30 years.
Angela Bennett, CEO.
Positive urine test does not confirm pregnancy. It only indicates you may be pregnant. Only a doctor can diagnose and confirm pregnancy. If you used a home test and need answers immediately, the SCV Pregnancy Center will provide immediate pregnancy test results and uses the latest technology to confirm and diagnose pregnancy. The center specializes in pregnancy testing and confirmations. Make your appointment today.
Visit scvpregnancycenter.org.
All services free and confidential.
Your hometown station.
Welcome back, folks. You're listening to Aging with Power on your hometown station, AM 1220 and 98.1 FM, and we are talking with Paul Davis of Paul Davis Insurance. And we were talking off air, folks, don't try to navigate this minefield on your own. I mean, my goodness, Paul's been at this for more than 3 decades. As I told you, personal experience of him helping me out of the minefield with my mother. So, Paul, I mean, you've shared as much as we can share in such a small time. And now that people's eyes have glossed over and heads are spinning and exploding, how do they utilize Paul Davis and what would it cost them? And what are the issues of asking your advice and help?
So I've got pretty much of an open door policy that anyone that gives me a call, I'll at least take their call and see if I can help them. If it's pro bono work, if it's someone that I know there's no way that I can do anything that's going to get me any compensation, I pretty much try to limit that to about 15 or 20 minutes, but in that time I can give people a reality check. When people decide to purchase products through me, Medicare Supplement or Medicare Advantage plans, they don't pay me anything. They don't pay me an extra fee, and they don't pay anything more than they would be paying if they went directly to the plan or enrolled in their toll-free number or went on their website. So I get paid a commission when I enroll people, but my promise and my vow to anyone that I deal with is I'm never going to just talk someone into something just so I can make a commission. There are dozens, if not hundreds of people I've had conversations with, and when I talk to them, I say, you should keep what you've got. I don't have anything better to offer. And people love getting that reality check because they're not sure if they've been taken advantage of, or they're not sure they're on the right plan. And I'm happy to provide that reassurance to people at no charge to them.
And bottom line, it's pretty simple math. When you expose the facts to them, it's pretty easy to show them, 1 + 1 = whatever, because, again, it's simple math. So how do they get a hold of you, Paul? Your website, your number, your contact information? How does someone find you?
So my website is tdinsure.com, P as in Paul, D as in Davis, INSURE.com, and my toll-free number is 800-487-0880. So you can take a look at my website. You can send me an email off of that, or you can give my office a call. If you contact me, let me know it was because you heard me on this show. I always like to know how people heard about me.
That's awesome. And I know this time of year for you is like March and April for CPA. So, Paul, I appreciate you taking the time out and talking with us.
All right, Miles. Thank you very much for having me.
My pleasure, Paul. Thank you.
Take care.
All right, folks, that was Paul Davis, and I'll touch back with his contact information here in a minute. But still in the house, quietly listening to all this, was my original folks that we spoke to was Chelsea and Dr. Wong from Kaiser. I know folks possibly are driving or whatever, and they know my contact information. As I mentioned earlier, too, folks, if you missed any part of the show, go to hometownstation.com, pull up the podcasts, and go to Aging with Power. Point people toward this is very informational. Dr. Wong, any closing remarks? Anything you'd like to say to folks? I mean, if they want to get a hold of you, we're going to have them come through KHTS, and if they want to do any more due diligence on Kaiser as a plan, now they've actually got an asset in Paul Davis that could also talk about the pros and cons of changing from Medicare to Medicare Advantage. Any final words for us?
No, I think people need to just take care of their health and really, a lot of people just kind of go life along and everything is fine, but they don't really take care of themselves. So really, take care of themselves, get what they need. If they need a colonoscopy, or they need a cholesterol check, or even definitely the flu shot. I know the flu's coming, and we have a flu clinic starting September 22nd. Just taking care of themselves is really important.
Awesome. Well, again, thank you, Dr. Wong. Chelsea, thank you for setting everything up, and I'm sure we'll have you guys back at a future date. I didn't get to touch on it too much as we open the show, folks, so real quick, I want to circle back to Caregiver Resource Day coming up, put on annually by our Santa Clarita Valley Senior Center. The family caregiver is in the billions of dollars if you were to assign a dollar figure to it. I mean, we are sometimes, as a family member, as a spouse, as an adult child, are thrust into the role of being a caregiver to a loved one. The doctor, is getting ready to discharge, and they say, well, they're going to need home care, and this is what you're going to have to do. And they become what is known as a family caregiver. A lot of times they feel they're on an island, there's no resources, and that's certainly not true. So put on your calendar, if you know somebody who knows somebody who's caring for an elderly loved one, or anybody who is recovering for illness or injury, coming up a couple weeks from now, Saturday, September 15th, 9 a.m. to 3:30 p.m. at the Henry Mayo Educational Center. Is Caregiver Resource Day. We have a couple keynote speakers. Comfort Keepers is proud to be a platinum sponsor. It's so important to empower and educate our family caregivers, but they'll be talking about things that really affects where the rubber meets the road. There'll be resource tables there, so there will be senior resources and other resources that are right here in our community, be it home health, be it hospice, be it anything that's related to caring for a loved one in the home, or overall issues that may not be in the home. So Caregiver Resource Day, there is a $10 registration fee that covers all of the sessions, the resource materials, access to vendors, etc. So please call the Senior Center, 661-259-9444, or reach out to me and I can point you in the right direction. I don't know, this might be a little biased, but what a great show. Thanks again, guys. Folks, that does bring us to the end of the hour. Thanks to Dr. Wong of Kaiser and Chelsea Shriver for setting it up for us, and Paul Davis for calling in with his expertise on the upcoming open enrollment period for our medical benefits. If you have topics or requests, email me directly, mileswithany@comfortkeepers.com. Would love to bring the subject matter experts on for you. We're sponsored by Comfort Keepers In-Home Care. I'm Miles McNamara of Comfort Keepers. And remember, folks, aging is not a disease. It's a journey. So do it with power.